that is where we had our first index cases in this country. So we have detected 1,821 out of the 311,226 tests we have done, giving us a positivity rate of 0.6%. Guidelines for both PCR antigen tests have also been developed, and this is in circulation and in use. We've started genomic sequencing to try to identify the type of variants that we are seeing in our country. That will help us fight the battle better. Tracing so far, contact tracing have depended on reported cases. Airport testing is working that well. Mandatory quarantine for all positive international travelers. Supply of vehicles for contact tracing, that is what we did to facilitate them to move faster and work more efficiently. We have actually had an effective ambulance system that is helping us fight the COVID battle. In fact, if we hadn't been a bit visionary and had brought in the 307 ambulances, one per each constituency, we wouldn't have known how we could have fought the COVID battle. We have had tremendous support from the ambulance service with the rolling stocks that were put in and some investments that we made there. Now, we managed to get isolation centers, which are still running in the system for further endemics or pandemics if we should face any more. I believe we have motivated staff who have helped us that much. We started giving them allowances, and this has helped us quite a lot. Now, treatment. Currently, there are 73 treatment centers in the country. Each has a treatment facility, 11 in Greater Accra. All teaching hospitals are treatment centers now. Tema and Ridge were the only facilities at the beginning of the response. And initially, early March, when the president requested that we should take him around to see what we call our treatment centers, we went to only Tema and Ridge. And even what was there, as I speak, with the investment that we've made into treatment centers and the expansion things that we've done in the teaching hospitals, those two places, you wouldn't even call them treatment centers any longer. All treatment centers are generally well stocked with PPEs and logistics for patient care that will last more than 20 days. Oxygen strategy is being developed for oxygen supplies or availability with technical support from the Clinton Foundation. At the moment, we have actually built up our oxygen supplies. Critically ill and severely ill people have seemed to gone down. Our ICUs seem to be a little bit empty, but we are forcing ourselves to ensure that if you should have a wave, you wouldn't get into a situation where we are struggling for oxygen. But in the medium, long term, we're developing the strategy that will be implemented to make sure that we wouldn't be crying about oxygen any longer. For the time being, we are getting support from USAID and Clinton Foundation to give us some plans that will help us actually increase availability of oxygen for the moment. Reasonable private sector support have managed to create what we call the Ghana East Infectious Disease Center. And we have actually linked to the private sector. I can mention Yahoo facility, for example, which is also now a key treatment center for us in the country. We have improved capacity building for staff, and virtually all the treatment centers we are talking about now have some level of staff that can actually do treatment efficiently, just like we are doing at Ghana East Hospital and the Infectious Disease Center. A private sector COVID fund for COVID-19 was also set up. We are now working to try to see if we can make that place a permanent sort of fund to support the health system, make it a little bit more resilient. I have said that we now have staff with capacity to manage ICU in all regions, compared to only 6 during the assessment in June 2020. So we've also made some good improvement. This is capacity to manage severely and critically ill cases that we seem to have improved upon. We have started processes towards the establishment of a Ghana CDC, and that will be a big legacy that this pandemic had pushed us to look at. And we will soon be establishing CDC that will be sitting permanently to be tackling infectious diseases. Now, let me go back or continue with vaccine procurement and deployment. A comprehensive plan was developed to vaccinate 20 million people, which is about 60% of the population, in phases, starting with most at-risk groups. You might wonder why Ghana was the first country to have benefited from COVAX initiative by sending the 600,000 doses of AstraZeneca sometime late February. One reason was that our vaccine deployment plan was about the first to have been done in Africa. When we sent it as part of the requirements for registration to receive vaccines, ours was adjudged the best, and therefore they couldn't hide themselves, shy away from us. That is one of the reasons why they sent us the vaccines first. COVID consignment 600,000 AstraZeneca was received, and on the 24th of February. We started deployment on the 1st of March, 2021, and we plan to vaccinate all individuals 12 weeks after their first dose. And you know what might have happened now. After the first jabs, we had challenges with vaccine availability, and so we needed to hesitate a little bit. Remember, I have mentioned here about our zipline and drone deployment into our health system supply chain. Luckily for us, when the vaccines came in, we used the drones to support us distribute vaccines to some areas where we needed to vaccinate our health workers and those people who were identified to be in the first phase or the first cohort of population. Between 17th and 21st May, a total of 38,547 doses of vaccines were delivered to various places with the drones. Apart from the 600,000 vaccines we received from COVAX, I must mention, and we are thankful to India, the Indian government donated 50,000 doses. Now, MTN donation on 2 tranches of 315,000 doses on the African Medicines Platform window. Now, because of our fast deployment of our vaccines, countries that received some vaccines in Africa, some of them couldn't administer very quickly, so some were withdrawn, and we became beneficiaries, because COVAX still wanted to help us get the second dose to people. So they gave us another 350,000 withdrawn from Congo into this country. Now, I must say, because of our performance, the sister country close here had actually sent a team to come and see how Ghana was managing our vaccination and how we were moving at that very fast pace. Côte d'Ivoire had visited to learn peer review from Ghana in terms of vaccine deployment. Those of us who have not had our second dose yet, there is a lot of hope. We have indications that is giving us hope for the very near future. We are expecting vaccines from the US. We've got a promise from the UK to try to help us get our second dose go through very quickly. The numbers are just about what will give us the gap that we have with the second dose. The exact date that is coming, we don't know, but we anticipate this late June, early July, these things will happen. Science is now telling us, I've told you several times, that this disease continues to manifest itself against all scientific thinking. Today it is this, tomorrow it is that. That is how this virus is treating scientists on the globe. Now they are telling us that even if you don't get it within the 8 to 12 weeks, you get even better protected if the time span between your first and second jab is a little bit expanded. So you shouldn't get too worried. If you have the first dose and you haven't got the second dose within the 12 weeks, you're still going to be protected until we give you the second dose. But that will not be longer. That will not be longer at all. So there is hope. And let me assure you that government is working in all fronts to try to find the vaccines to do the vaccinations for those who haven't had the second jab, and then start with new vaccinations for the first dose. In the instance of vaccine availability, we are not careful. Vaccine hesitancy that we thought had reduced might begin to come up again. So we need to do a lot of education in that area as well. I'm still talking about vaccine availability. Vaccines has been a little bit murky in country. When we got announcements that we're not going to get vaccines as has been scheduled from India through the COVAX window, we needed to look at how we can get vaccines to vaccinate our people, protect our people. At the time, FDA had approved only 2 vaccines, AstraZeneca and Sputnik. AstraZeneca had closed its borders, and there was no way any vaccine was going to be shipped from India. So the only other option to engage was the Sputnik. Our first effort was to try to do bilateral engagements. It yielded no significant results. We had to write to the foreign minister of Russia. We wrote to the health minister of Russia. We wrote to the trade minister of Russia, trying to see how best they can facilitate us to do bilateral engagements so we could buy Sputnik from the source. All these didn't yield any responses and no significant results, to the extent that we even invited the deputy ambassador of Russia for an engagement, and he couldn't facilitate our move. We therefore had no other option than to try to engage middlemen to see how best we can get the vaccines. In the process, we signed 2 agreements. One that was going to sell vaccines to us for $19. The other one was 18.5, and not 26 that has been reported in the media that we have procured another vaccine for $26. These agreements that we signed were done with the view that it will only become operational after we have placed orders and have issued letters of credit. So if you haven't done these, the agreements were just going to be sitting down redundant. So we needed to operationalize with 2 activities. The first one, the $19, we had a delivery schedule that will span the 3.4 million committed quantities to be delivered in 3 months to July. The first tranche was 300,000 that we issued an LC for. The LC delayed, and after its confirmation, about 3 weeks after we started the process to get the LC go, the supplier only told us that he had run out of stocks and we should give them 2 weeks. They were expecting deliveries from Russia. Later, they came and said to us that they can only deliver in July. So when we delayed a little bit, they have sold their stocks. So they were selling to us at 19. I don't know how much they sold to other people, said that the stocks ran out before our LC got ready. This has become some massive debate in country, but government is committed that no matter what, we will find the vaccines to try to protect our population with. On the face of regulation, we had emergency use authorization, which is working well. FDA had approved now 3 vaccines. AstraZeneca and Sputnik were the first 2, and quite recently, about 10 days ago, Johnson & Johnson had been added. And let me let the country know that we have placed orders with African Medicines Platform in our efforts to engage bilaterally. And we have indications now that we have approved Johnson & Johnson that our first batch of vaccines to come from that window, the AU-supported procurement, will begin to arrive in this country sometime in August. We are still waiting for exact date. And between now and August, it's not too far. If we behave ourselves well, we can wait. We wouldn't die before these vaccines also arrive. And we have quite a large quantity to spread across 2022. So government is working so hard to get our people vaccinated. FDA, we have announced earlier, had actually got regulatory maturity level 3. This means that FDA approvals could be accepted in many other countries, even including the WHO. And in the last World Health Assembly, it will be a point of interest to know that the Director General of the WHO actually acknowledged the Ghana FDA. Adverse events after vaccinations, monitoring of vaccines and other technologies is continuing. This is where I will end my first presentation on COVID. I've done the current situation. I've gone through vaccine deployment, and I've talked about regulatory issues and treatment centers as well as laboratory centers. These are areas where we believe we have done so well and will leave legacy for this country to make our health system a bit more resilient. Now, let me come to our health system indicators. Despite COVID and all the challenges that we had, I believe a normal, traditional service provision that we're doing prior to COVID. Let me mention a few of these indicators. We'll look at our HR situation. Midwives to women in fertility age, population ratio, has improved considerably over the last 5 years, from 1 to 943 to 1 to 560. So now, in the past 5 years ago, 943 women in fertility were being taken care of averagely by one midwife. Today, if you look at the population and its distribution, we have 560 depending on one midwife, which is quite a significant improvement. Our doctor to population ratio, this has improved consistently over the last 5 years. Between 2016 and 2020, we have moved from 1 is to 9,301 to 6,355. So when one doctor was catering on the average for 9,000 plus people in 2016, today we are looking at a situation where one doctor is catering for 6,335. And we continue increasing the numbers of trained doctors, and we are even supporting them for specialist training. You remember we have announced earlier that government has taken care and awarding scholarships for all doctors who want to specialize and get into disciplines that's a bit rare for them to continue to provide service in a better manner. Nurse population ratio also has improved from 1,727 to 1 is to 70. 1 is to 701 over the last, between 2019 and 2020, against the WHO standard of 1 is to 1,000. So now for our nurse patient ratio or population ratio, we are even doing better than the WHO standard, and that is a significant achievement. There is, however, a challenge with inequity in the distribution of our health professionals, particularly doctors, which is being addressed, including all other health professionals. We have problems with some areas that health workers will not want to go to live to provide service. We have set up a committee that is now working on what we call incentive packages, things that will attract people to areas where we don't have them and areas where people may not want to go. We're getting support again from USAID, technical assistance, to try to see how quickly we can get this package done and implemented. We will soon announce when we get into that terrain. Institutional maternal mortality ratio has also seen a remarkable decline over the last 5 years, from 151 per 100,000 live births to 109.2 per 100,000 live births. So if you're moving from 100,000 live births to 109, what we are saying is that maternal mortality ratio, people were dying 151 out of every 100,000 live births, and now it is just 109 live births. This achievement can be attributed to strict adherence to maternal health protocols and guidelines and the implementation of maternal death audit recommendations. Maternal health services have also improved despite the COVID-19 pandemic and associated restrictions. Trends over the last 5 years show increases in PNC visits from 47.3% to 55.9%, and scale delivery from 55.5 to 58.7. Institutional malaria under 5 case fatality rate improved over the last 5 years from 32% to just 12%, and that is a significant achievement. Tuberculosis. TB incidence per 100,000 population declined from 49.38 to 40.16 over the last 5 years. HIV 1990 target over the 2016-2020 period. HIV persons knowing their status 40% to 74%. We are supposed to test people with HIV for them to know their status. And the target, WHO target, is 90-90-90. 2016, we were doing 40%. 2020, we have moved to 74%. The second 90, persons that are known to be HIV patients should be put on antiretroviral, the prescription. We were doing 39%. Today, we are around 69%. So we have been able to administer medication to 69%, close to 70% of people that have been tested to be HIV infected. So on ART, with viral suppression, we were measuring 58%. Now we have 73%. Annual HIV deaths, unfortunately people die, have also declined since 2017, from 17,000 to 13,000 in 2020, due to survival linearity with almost equal proportion for both genders. Our doctors, we have realized now that those days after housemanship, you have to sit home some 2 years, some 1.5 years. Today we have sort of a virtual transition. You finish housemanship, and within a month or two, you actually logged on to the payroll, and you'll be posted to get work to do. Training and recruitment. Over the last 4 years, which is a whopping 49%. 68,000 health professionals were recruited into the various cadres in the health professions between January 2020 and December 2020. Now, applications for 58,000 health professionals out of the 68,000 were actually processed. In the year 2020, the government of Ghana paid an amount of 173,400,000 as a trainee allowance for 48,167 students into the health training institutions across the country for the 2019-2020 academic year. The ministry in the year 2020 compiled 724 names of health workers who were due for promotion. Out of this figure, 644 health workers were duly promoted and received their promotion letters. Those who didn't go through, 36 candidates, we wish them well, and we believe next time round they will actually move themselves up a little bit. That is the front of our health indicators. I've moved through the disease burdens, through with HR issues. And let me also announce that as I stand here, we do not owe health trainee allowances to anybody. This year we have paid 2 quarters to all the health trainees in the country. NHIA, you believe, is the catalyst for achieving universal health coverage when it comes to affordable access to healthcare. Ghana situated itself quite enough time even before this policy was pronounced. Who is being covered? Active annual membership for 2020, we have seen a tremendous improvement. 16,310,325 people. That is about 52% of our population. This figure has moved from around the 49% or so in the past. We have those we call indigent active members, that has increased. Informal sector has increased. Under 18 have also increased. And that is giving us this massive increase. We have 4,292 providers credentialed in all the 16 regions to provide care or service. 55.2% of these are CHIPS compounds, health centers 16.8%, primary hospitals 8.2%, clinics 7.8%. And then we have ownership across the various groups of healthcare providers. The public service has 69.7%, private 24.2%, and the mission hospital 5.3%. We're providing all manners of services, OPD, IPD, maternal services, oral and eye care, diagnostics, and medicines. Utilization dropped during COVID to 1.9 million for April and May, but currently we are doing close to 3 million visits from our card bearers every month. Payments. So far this year, we have paid 486,871,300 Ghana cedis to our credentialed service providers who submit claims on time. We've released to claims in 2020 up to December, and we are preparing to do January 2021. Our monthly reimbursement on the average is about 97 million for the first 5 months. Some of our subscribers submit their claims late. Some are as late as about 5 months. And we are still receiving submissions for March and April. So effectively, what we have, documents that we can say we are owing, will be about 2 months in this year. And quite soon, January, will be paid, maybe this month. We have built a new actuarial model to ensure financial sustainability of the NHIS. What are our achievements? We've mentioned proportion of population that is active. We had 40.6%, which has been moved to 52.6% between 2016 and 2020. We can attribute this to the technology that was introduced, the mobile renewal registration. So you sit on your bed and you can register or renew your registration. A significant improvement in our work is the fact that claims arrears have been reduced from 12 months to effectively just about 3 months over the last 4 years. One will wonder, you haven't paid January and we are in June. The law stipulates that we should have 3 months within which we can receive claims and prepare to pay them. So if you're looking at effective arrears, we should be about 3 months. And we inherited 12-month situation. So over the last 4 years, we have reduced that to just 3 months. And if you're able even to pay before the end of June, the January one, that will be equivalent to 2 months arrears. And that is how come health insurance has begun to be robust, and our numbers for registration is increasing, and people are now utilizing our service. That is a very good move for us towards achieving universal health coverage. We have introduced technology that is authenticating at the provider sites for clients, patients, to see whether they are billing me correctly or they are just cheating the system. We have linked health insurance card to the national ID card using technology. So far, 89,000 Ghanaians are actually using their national ID card instead of health insurance card to access care as registered health insurance clients. We have introduced medication for breast cancer as part of our prescriptions regime, Herceptin, together with partnership with the private sector company that is subsidizing the Herceptin medicine to treat breast cancer. We are now doing online credentialing for healthcare providers. This reduces inconvenience to providers. So if you finish your facility and you want us to accredit you to provide care, you can do online. And if you want to renew your credentials, you can do online. And we'll come and inspect you later to give you what you need to get to. NHIS has also linked itself to the Ghana Household Registry at the Ministry of Gender to ensure that no vulnerable person is left behind. This has been a very common phrase within the health system across the globe. Anytime you talk about universal health coverage, the next thing that follows is that no one should be left behind. To try to pick everybody along with us, we have actually joined with the Ministry of Gender that has a facility that identifies very poor, vulnerable people, so we can pick them before they even know we are coming to register them. We have worked so far on our costing of services that is completed now, awaiting for certain approvals. That is what I call the new tariff regime, which will give a little bit more money to providers to be able to take care of our people. Family planning has been piloted again successfully, and it will soon be added to the benefit package. Remember, in the party's manifesto, we say we'll expand NHIH coverage, benefit package, and that is where we are moving to. We have done costing for childhood cancer and prostate cancer, and this will also soon be added to our benefit package. Again, we are doing serious costing on prevention services. Said that soon, if you are successful in that endeavor, we will begin to add cases like hypertension and diabetes for prevention, again, onto our benefit package. The NHIS has actually launched a YouTube. This will give regular information updates to the public. And we'll also use the Health TV as well to try to do public education, health education to our population. Despite these remarkable achievements in NHIA, unauthorized or illegal payments are rising in most of the credentialed healthcare facilities through different forms. This week, a radio station started airing a documentary they produced on out-of-pocket payment in the Greater Accra region. Last Monday, on the 14th of June, the station aired excerpts of the documentary from two facilities, Mamprobi Polyclinic and Mamubi Polyclinic. Together with NHI and Ghana Health Service, a joint monitoring team visit will be undertaken soon to address the issue. But let me announce once again, I have said this here before, that the ministry has set up a small unit within this PPME directorate we call the Health Intelligence Gathering Unit. It is commissioned to pick information and investigate illegal payments at the various healthcare facilities for prompt action to be taken. That is not the only demeanor. Several other facilities that are operating without licenses from HEFRA, licenses for their health professionals from Nursing and Midwifery Council, from Medical and Dental Council, from the Allied Health Professionals Council, and all the regulators. The Health Intelligence Unit is assisting on their way. When they find those things, we'll refer them to you for investigations and further necessary action. My colleague minister, let me thank you, ladies and gentlemen from the media. I'm very grateful for your audience.
Minister, we're grateful for the briefs that you have shared with us this morning. And these three briefs, if I was following you properly, are very rich on data. You've given us a lot of data. So I think one of the first things we'll do is that I want to ask our colleagues in the production suite who manage the press pool platform to please make the presentation available with all the data in it. And then I want to ask of you, our colleagues, there are a lot of stories that you report on the health front. And it is right that you report when you hear worrying stories about, various things. But when we also make information available full of data like this, that shows the kind of collective progress we are making. We beg of you to make time to highlight and interrogate this data that we have put. Don't brush it aside and let's move to the next bad story. Let's make some time also to interrogate this data. Is this data that the minister is putting out here, is it true in the first place? And if it's true, what does it mean for us? For example, if the doctor to population ratio is improving or has improved, what does it mean for us? Is it true it's improved as significantly as he says? And if it has, what does it mean for us? The nurse to population ratio, is it true we are doing better than the WHO standard now? Is it true? This is a minister's claim. And if it's true, what does it mean for healthcare delivery across the Republic? Doc, as you were talking about doctor to population ratio and the fact that there's, however, an imbalance. You find that a lot more of the doctors want to go to Accra and Kumasi when in many other districts we need doctors. In my district, Achimansa district, Dr. Kranting Ampao Prince, thanks to your ministry and your directors who are here, he has come and he is working there. So I just thought I should let you know. Say again? Because of what I did. Well, yeah, because we also offered some incentives, as well. So I just wanted to mention that not all the doctors want to come to Accra and Kumasi. Dr. Krante Mpa Prince is in Achimansa district. Colleagues, that was just by the way. It's a good time to take your questions now and to interrogate all the things that the minister has put out. Also, in particular, the developments on the NHIA front. So, Minister, you're saying that active membership has moved from about 40.6% in 2016 to 52% as at the end of 2020, which means that as at the end of 2020, 52% of our population is now actively using the National Health Insurance Program. That should be my understanding. I think I understand you clearly. Colleagues, let's have the microphone, and it's a good time to take your questions, and then we'll provide answers to them. You know we like to be biased towards the ladies, so I see you, the gentlemen, but let me see if I'll find ladies to start with. Any ladies? So let me start with my gentleman. I'll take the first three plus one at the back, making four, and then we'll continue. Please introduce yourself.
Okay. Thank you, Honorable Minister. My name is Paul Nyoja Dalafu from the Daily Statesman.
From the Statesman. Please speak up a bit.
And my question has to do with, Honorable Minister, what happened to the persons who have failed to renew their health insurance membership within a year after expiring or more? And also, some doctors or nurses refuse to go to their postings in the rural areas. Have you done anything to improve their living conditions there, that they can be saved there to work? So I have a question that has to do with some personnel. Also, sometimes when you get to the hospital, you see the nurses, instead of attending to you, the moment they see you, they begin to touch their phones and flipping through their phones to see what is going on. Have you taken your time to investigate these things as to whether it hampers on health of the patients? Thank you very much.
Thank you. So you want to know about persons who fail to renew their NHIA cards. Are there consequences? NHIA boss is here. And for the heads of the agencies who are here, Minister, with your permission, can I invite some of them to answer some of the questions? Very well. So NHIA, please take note of that. I'll bring you up. There's a question about doctors and nurses who refuse postings to some of the rural areas. Is there some policy position on what sort of incentives or what to do in a scenario like this? Dr. Patrick Abuaji is also here, Ghana Health Service. So please also make a note of that. And then there are reports of poor customer service by some persons in the health value chain. I think it's better to broaden it that way. Many of our nurses do a very, very, very great job. But there are still reports of poor customer service. What is the policy position on the poor customer service in the health value chain that is sometimes reported, and what can be done about it? Yes, sir. There's a hand at the back. Yes, sir. Please introduce yourself.
All right. Thank you very much. My name is Abu Bakar. I work for Tinka TV. I want to know if there's anything or there's any plan for Ghana to be able to produce vaccines locally. Is there any conversation like that?
Yes, there is. I think it's been announced. I mean, the president has spoken about it, Dr. Nsiasai. So, yes, there is. But beyond the fact that there is there anything specific you want to know? So, I think it would be fair to know the status of the conversation or the program, because that one is clear. There is. But the status of the conversation is a matter of interest. And then let me take these two for the first one. Yes, sir.
Yeah, thank you. My name is John Awuni. I represent Kesbin. I just wanted Minister to give some updates on the President's COVID address to the nation. He did mention 88 district hospitals were going to be constructed. I want to know updates on that. How far has the project gone? Thank you.
Thank you. 88 district hospitals, then later, in the words of Chairman Sabunsu, transmogrified to Agenda 111. We'll get answers. GNA.
Yeah, Honorable. My first question is, as the Honorable Minister said, those who have taken their first dose, if they couldn't receive the second dose within the 8 to 12 weeks, shouldn't be worried because they will still be protected. And I want to find whether he's saying it based on scientific proof, because in recent times, doctors have been telling us that within 8 to 12 weeks, we should take it. And so if now we are saying, even after this period, you don't get it, you shouldn't be worried because you'll be protected. I want to find out whether he is saying based on scientific proof.
Dr. Abuaji, please take a note of it.
Then two, as you rightly said, you have set up health intelligence unit to deal with this illegal payments in our health institutions. I want you to give further indication as to the sort of punishment that will be meted out to offenders who are taking those
Which
things.
particular offense are you talking about?
Like, he is saying that they will take prompt action against maybe health officers who are caught taking illegal payment or something like that. I want him to give us detail as to a specific punishment that will be meted out to those people.
Okay, on the matter of illegal payments for health services, are there any sanctions? Very well, very well. I'll come to the back. Let me see. Okay, this is the first batch of 4. So I think this is what we'll do. This is our first batch of 4. Let me ask health insurance. Dr. Janice Albe, please join us and take off the issue of persons who fail to renew NHIA. And you may want to even touch on this other question. Please come this way. The staircase is here. For those who are taking illegal payments, are there any sanctions? You may want to deal with those for me. Then 88 district hospitals, I'll go to the minister, as well as the vaccine local production question. I'll come to the minister. And Dr. Abuaji will deal with doctors and nurses and then poor customer service for us. Dr. Selby.
Thank you very much. The NHIA has a policy that if you default by more than 3 months, when you renew, you serve a 1-month waiting period. I think that's the policy in most insurance systems. The only people who are exempt from that is pregnant women and children under 5. We all know that children under 5 can be seriously ill, sometimes in the space of an hour, and we can't afford to wait. And for pregnant women, obviously, it's free, and we need to get them treated. Everybody else, you serve a 1-month waiting period. And our system is hardwired. You cannot pay somebody within NHIA to take away that unless they register you as a pregnant woman or a child under 5. A few have tried, and we've caught the staff and sanctioned them. Illegal payments. We have a call center. Those who call, we follow up at the facility, and we have been able to take the money back and give it to the person quite a few times. But what we find is patients are very reluctant to report perceived wrongdoing at health facilities. We all know what we feel about a hospital and healthcare. You never know when your turn will come. So people are very reluctant to report. But a few who do, we are able to get their money back. Myself and Dr. Abuaji, we're doing some research around this to see what we can do to halt the spate of illegal payments. And as progress comes along, we'll keep you all informed.
But it's important to report so that some action can be taken. Dr. Abuaji, let me invite you to the podium. Doctors and nurses who refuse postings, what is it? And then reports of poor customer service. What can you say about that? And then I'll invite Minister to deal with the other two.
Yeah, thank you very much, Honorable Minister. Yes, the issue of refusal of posting is a major headache. We have seen 2 key issues. It's more of perception and obviously deprivation in those areas. So what we have also noticed is that people hear a certain region and they say, I won't go there because they really feel there's nothing there. And we've started looking at going around the medical schools just before they graduate to introduce them to this region. I've also been speaking to the regional ministers and the district directors that market the region. I've just returned from Northeast because it's a very nice place, but people have this perception that it's just like a bad place that nobody needs to go to. So I think we also need to market. But we've also put incentives that after 2 years, you are eligible for transfer if you want to stay. These are some of the things we are doing, and also trying to ensure that accommodation is provided for those who go there. Because sometimes, even if you go and you have money to rent, you may not find a place to rent. So these are some of the challenges, but we're trying to get over them and ensure that people are able to take a posting from there. So we continue to work at non-financial incentives for them to go there, whilst we are looking at some possibility of a financial incentive. The minister has set a committee to see how they can create something that will attract people to these less endowed regions. Staff attitude remains a problem. And the minister said about 95% of the people do the right thing. But that's what they're supposed to do. It's the 5% or 1% who do the wrong thing that's of concern to us. Currently, we do investigation. We have a report of somebody from some part of Accra, which we are currently investigating the person's attitude. We also, as a service, trying to brand ourselves. And the branding is not just about how we look, but also branding the people to behave appropriately. And we are seriously working on that to ensure that this is reduced. But the most important, that people must report. And if they report, we make sure that now when we punish them, we let everybody know that some sanctions have been taken so that it will also be served as a deterrent for the others. Do I go on the vaccine?
The local vaccine production program.
No, 6 months.
Yes. Please deal with that. I think I missed that one.
Currently, I think...
What's the science behind it?
For COVID, everything is still ongoing. And so we started at AstraZeneca, the repeat was 3 weeks. And we realized that 8 to 12 weeks was better. We also know that further evidence has shown that even beyond the 12 weeks, still get protected. Even though we may have a reduction of about 34% of the antibody, we still are protected even up to 6 months. But of course, for vaccination, what is most important, the duration between the first and your booster dose. That's the earliest time. And so even though you may not be as protected as somebody who has the peak antibodies, but you still have some significant protection, either from severe disease, infection, and death. And so that's what it is. So there's some science behind the extension that even those who have had one dose are better protected beyond the 12 weeks than those who are not taking any vaccine at all.
Thank you. I want to invite the Honourable Minister to respond to the outstanding two issues, the 88 district hospitals and then the status of the local vaccine production program. And then I'll come for the final batch of questions.
Let me start with the 88 district hospitals. Things are on course, and God willing, before end of July, we will see the launching and the shortcutting of the project, the 88 district hospitals. It is no more 88, but we now call it Agenda 111. We've added on, because when we picked 88, there were complaints from some districts and some regions, and when we went to do investigation, truly, their complaints were genuine, and so we had to add on. I don't even know by the time we complete how many we might have actually added on, but that is work in progress. A lot of things have been done: land acquisition, inspection, soil testing, designs. All that is virtually completed. Even our letters have been given, so people have been selected, and by end of July, we will see action in progress. The vaccine issue, production. The government has set up a committee for vaccine production, chaired by the Minister for Environment and Science. They have also done a lot of work. Committee members are picked from the scientific world, some in the ministry and other scientific institutions. They are working very fast. They have even visited, and they are partnering with private sector companies that were originally also preparing to produce some semblance of vaccines in our country. Looks like 3 of such facilities have been picked up. And they are liaising with the international community to see how they can start working. Their strategy is to try to do what they call filling and packing first, and then the science community will also take some time to start developing vaccines in our country. So that area is also seriously being considered, and we are actually on course in that direction. Thank you.
Minister, thank you. I'll take a final batch of questions. There's a gentleman in white, there's Ghanaian Times, Akable, and then I'll take the last two here. Not more than 2 questions each. Not more than 2 questions each, because we're running out of time. Let me start with you. Yes, sir. You've had a question already. So let me go to the other gentleman in white. Yes, sir. Not more than 2.
All right, I'm Chair for aviation TV. My question will have to do with the blood bank. There was an incident at Ridge Hospital, Greater Accra Regional Hospital. I was there myself. Some men have donated in advance pending the CS for their wives, only to be told that morning that there's no blood, while the wives were prepared for CS. And I'm sure such incidents are the kind of incident that discourages others equally from contributing. Initially, you used to work in tandem with Ghana Education Service, and you go to schools for this kind of donations. What has happened? What can we do as far as this is concerned? Because it's an alarming situation.
Thank you. So the question is, what are your plans to ensure that you're able to get supply up? Colleagues, let's keep our questions as quickly as possible. Ghanaian Times, not more than 2. Then I'll go to Akable and come this way. Not more than 2 each. Let's be quick.
Thank you very much. Minister, last year, the president cut short for a number of hospitals to be constructed, including that of the La General Hospital, one at the Tema General Hospital, and other places. I would want to find out the status of work. Why hasn't actual work commenced in some of these hospitals? My second question is it true that we are beginning to see an upsurge in COVID-19 cases in the Ashanti region? Thank you.
My minister presented the data, correct? So I'm sure that question is self-answered by the data that was presented. Akable, not more than 2. So, Minister, the question that I'll come to you on is, and I think while at that, you have to clarify. When sometimes politicians and project managers say that work has started, doesn't necessarily mean that blocks have started going up, or there's some work that starts, which is work has started, but you will not necessarily see blocks up. And while at that, please respond to the question of people who haven't seen blocks going up in some of these projects. What do you say about it? Joseph?
First, on our engagement with middlemen for the vaccines, I just wanted to find out what specifically is the way forward. And I'm asking this because the statement from the ministry earlier indicated that there's the option of terminating the agreement if the supply delays. Here is the case. It tells us that there was an issue with the LC being available early. He again says that in terms of the $19 deal, they have up until July to supply it. So I wanted to know what is the decision related to that. And the second issue has to do with the $18.5 one. He didn't give any details on the current status. And the other question, maybe it's a question that Mr. Minister, you can answer.
Actually done 2 for me. You've done 18 and 19.
It's one question.
Let me take your other colleagues. Joseph. No, go ahead. You ask.
No, it's a question for you.
For me, go ahead.
It's about the COVID compliance issues. Mm-hmm. What's the latest on the fallout from Sir John's funeral, Kojo Usefriye? The latest I heard on it is that a gentleman was claiming that he had been invited and interrogated by the police. But, I mean, it's an issue of concern. Health experts say that it's something that government should take an action and send the right message, especially because high-ranking public officials were at a program that experts say there were obvious disregard for the COVID-19 protocols.
I don't have an update on that. I would have to get you an update on that one. Abednego, quickly, then I'll come on these 2.
Good morning, Honorable.
Yeah.
Your friend Abednego Santia Sidu. We are Juma Wadom FM. If I show my question.
And I was ID, Ubedi, Nansan, and Nana.
Nansan,
to us,
me say, Honorable. Honorable, my question is, who card be a circulating on social media? I trust a COVID-19 vaccine passport. The person BBC say government are rolling out some policies say who to coin and I say obi okoba card be or higher COVID-19 vaccine passport.
Dr. Bade, patch your question we say obi yan wo chimu. Yeah.
Okay. And then agenda 1 Deputy Minister designated for Health, or appear before appointment committee, of Parliament, Okay, I say so far, verse 75 of the contract has been awarded. Verse honorable, maybe say, Niakano, our contracting, every number of the contract,
First of all, they are nominee, no kind, no crana, because I know Onyandu ministry work right now. Yeah. Until there are no eka, and we are no crana. But I'm saying, Minister Dikanka said some award letters have been given, and that by 1st July, some more details will be provided. Inti Yaman on 1st July, no, and I said July no kind, not 1st July, July. Now, omoma the data on that one. Nana, not more than 2. Let's make it snappy.
Yes, sir. Good morning, Honorable Minister. I have 2 questions for you. You said that the National Identification Card can be substituted for the National Health Insurance Card. What are the processes? Because a lot more Ghanaians will want to hook on to that thing because it becomes very easier.
NHIA.
Containing many cards on you, I think, is very cumbersome. So what are the processes one has to go through to access that this thing? And then my second question, the same health insurance. We were made to understand that before you pay claims, you do some pre-auditing and find out the problems, whatever, associated with it. People either inflating or over-invoicing their bills. Is that unit, is it still existing, or you are going to, because the minister said that you are going to set up an intelligence unit. So if that outfit is still existing, why they need to set up that intelligence unit?
No, the intelligence unit is at the ministry, correct?
So I want to know whether that
is not about health insurance.
Yeah, pre-audit this thing is still existing. And what is it doing now? Thank you
very well. So NHIA, 2 questions for you. The NIA card, NHIA, how does it work? And is your pre-auditing exercise still ongoing? And maybe while at that, does it make any impact? Final.
Okay. Honorable Minister, good morning. Please, my name is Emmanuel Boxen. I write for the Daily Graphic. My question has to do with, you said there's a new vaccine order that we are making, and it's supposed to arrive somewhere in August, Johnson & Johnson. I want to find out, is it something that we are paying for, or is it going to be like the COVAX scheme? Yeah, that's my question.
Thank you very much. So health insurance will take their questions. I think I've outlined them. Yeah, NIA, NHIA card synergy, and then whether your pre-auditing is still working. Then, Minister, I'll come to you to answer the question on construction. You know, when sometimes you people say work has started and we are not seeing blocks, what does it mean? And specifically like general, etc. Director Infrastructure is here. Today you have to earn your salary some more. You come and join me and then answer. And then, Minister, you answer the question on the way forward on the $19 and $18.5 questions for us. Chief, we're with you.
Thank you very much. At our NHIS launch last year, we publicized the 7 steps to link your Ghana card to the NHIS card, if you have one already. The challenge is people have different names, different date of births, and all sorts. So the 5 or 6 key indicators to be able to link are completely different between the 2 cards they are holding. So only about 100,000 have been able to do the link by mobile phone themselves. We are piloting in 4 districts in Accra. You going to the office to be able to do the link. And then after that, you can use your Ghana card. All the hospitals have been trained to accept the Ghana card, all the clinics. It's the same mobile technology that they will use to authenticate you when you go there. So there are 7 steps. I will get my team to do a bit more publicity around that 7 steps. But it's the same star 929, and it comes up linking your Ghana card to NHIS card. Star 929 hash. You can just follow 7 steps, and it will link the 2. And
star 929 hash. So that's your answer.
So from there you can do it.
Yeah. Pre-auditing, is it still happening?
Yes, we have claims processing centers that look at all submitted claims. Obviously, if you submit it electronically, we have some level of artificial intelligence that does a lot of the vetting. If it's manual, then unfortunately our staff have to manually go through. That is why we give ourselves 2 months from date of submission to be able to pay the claims, but it still goes on.
Thank you very much. Ghana Blood Service, what are the steps you are taking to ensure that you are able to step up supply? After that, I'll go to Ghana Health Service. To come up and answer your questions about the vaccine passport.
Okay, thank you very much. Last Monday was just World Blood Donor Day, and it's a day that is set aside for us to recognize the importance of blood donations as part of healthcare systems. And the whole of the month of June is also declared an education month, blood donation month. So we do a lot of education. But to answer your question, What happens is that we as a country are not self-sufficient for blood. We need 1% of the population to donate blood so that we can be self-sufficient. But we realize that our blood collection index per 1,000 population, which means the number of people who donate per every 1,000 population, is about 5, when it should be about 10. So we are not, adequacy is a problem, and also we're not having a lot of voluntary donors. COVID really affected us. At the end of 2019, voluntary donations were 33%. At the end of 2020, it was 17%. So it really, really went down. But to answer your question, what could have happened is that probably the blood was not available because people who are not donating blood, or the blood group that was needed for that person was also not available. Because we need to have all the blood groups available at every time. So my appeal is that we are doing a lot of education to get people to donate 17 to 60 years to donate, but even people who cannot donate, you can have advocates, people can volunteer. We're doing a lot of education, and we think that if we can all put our hands to the plow, we'll have enough blood, we'll have enough of the blood groups so that when people need blood, they would be available. So my appeal is for all of us to put our hands to the plow.
Thank you. I'm going to take you up on that offer. Colleagues in the press pool, we're going to invite you one of these days to come and join us for a blood donation exercise here at the ministry. I hope you will join us. I hope you join us so that we all contribute to fixing the challenge that they have there. Okay? We look forward to it. Thank you. Ghana Health Service, COVID passport. Minister, I'm sure you'll join us for the blood donation on that day. Yeah. Your age. We'll give you special dispensation to join us.
I think I bet no guys because I have to answer.
Yes, Chi.
Medasipi. Say COVID na bano. Any say bedroom rebi no. Okaso vaccinated. Ebusa say a DNA say you vaccinated. Unim say EU for estatiso mo can be na ebogu ye. Na WHO say enchen kakra. But enim say a dream rebi a sadi na beba say. Me see a vaccinated me anya say me kwa say me tiwe. Countries be actually on more card abre say. So about Kroma. No could if you take here card okuta say vaccination card ni. Yes, say they come for an affairs. They come be a country be say Ghana anybody because why vaccinated. No could say card we here. And no naturally say as the way say passport in that doing there at the floor. But no sentina we share Ghana card na. Your body will share QR code we actually. Your scanner. A bachelor say I am say I vaccinated. And yes, I will be able to me. I could church will be at the Abba. The name send by and the same say Colebu, a bibitisa. To say card be, Nana, near stop home into Sadiano is all being withdrawn. Into be a you soon a card no Kutano no say. We do club so. Let's almost say I am passing our vaccinated of our card bra. Now they are sharing some friend the passport to some friend you. It's a way of saying verify some pass why vaccinated. Near has a batch number at the ball no. No cray and I say times and the ball on the second dose no. Protective one whom say bit me. I ain't any idea. Yeah, Contisadi no. I'm say Colebu but I withdrawn to be a card okuta no. And then the best I mean it's just a bedroom maybe no. If you are seeing about special card, the boy has a yellow fever card here no. Bohun saw that betray say. And on actually say my vaccinate me to show say won't fire and come over and that's all console I want to pick here anyway. Honorable Minister, I think that's this.
I want to invite the Honorable Minister to respond to the final batch and then we'll wrap up. Minister, so construction. And specifically he was asking about La General. Director of Infrastructure, you take that one for us. The Minister will now do the way forward on vaccine procurement. And while at that, the August expected vaccines, whether it's COVAX or it's by purchase. So this is the Director of Infrastructure. He's the one in charge of, the construction.
Okay. Thank you very much, Mr. Honorable Minister. And good morning, ladies and gentlemen. And just as it was really indicated, when we come to projects, there are a number of processes that we go through. Those projects that were commissioned, that the President, His Excellency the President, cut short on. There were a number of them. I just want to run through and give you an update on how far we've come. The completion and equipping of the Confirmatory Maternity and Children's Block. the construction of the Eastern Regional Hospital, construction of the District Hospital at Obuasi, Enyinem, Enyiresi, rehabilitation and re-equipping of the Shama Hospital, construction of the Shama La General Hospital, 180 bed, construction of the Urology and Nephrology Center of Excellence in Kolebu, construction of 300 beds maternity block in Kolebu, then a construction of the Tema, I think this issue came up, construction of Tema, Nkransa, Doma hospitals. And then again, construction of 12 number hospitals in Jumapo, Kwabin, Nkwetia, Edukrom in the Eastern region, Achiase, Swami, Drobonso, Sabronumu, Manson Kwanta, Twedie in Ashanti region, Mem in Ahafo region, and also Pong Katamanso in Greater Accra. The rehabilitation of Efian Kwanta Hospital, and then the construction of other hospitals. What is happening is that as at the time that the president did the cut the sword, we had actually laid all these projects at value for money. As I speak with you, the projects are almost at the tail end of the completion. There are some of them that will finish the value for money. Value for money has already been completed on them. For instance, a place like Koforidia, those of you who bear me out, you can go there and I realize that the constructor has already moved to site. What is happening is that once the project actually gets started, or once the contract is firmed up after VFM, it takes almost close to 4 to 6 months for you to complete the pre-contract activities, where you do a geotechnical analysis to know the nature of the soil, so that it will inform your designs that will come up. You go through all this process. You will do what we call a stakeholder engagement with the beneficiary facilities, so that we'll be able to finalize the design before the contractor actually moves to site. So even though the contract might have been signed, it will take almost close to about 6 months before you see the project actually coming up. So that will also account for some of these delays. But I can assure you that, like those places that I've talked about, Kofori had started. Maternity in Konfanochi is already ongoing. Tema, we have just completed all the conditions precedent for contract effectiveness. And I can assure you that hopefully by the end of June, Tema should take off. Because we've been paid advance mobilization to the contractor. Tema, Nkransa, Doma, and also the reactivation of the central medical stores are also going to be completed in that batch. So all the projects that I've actually talked about, it was in no time. I'm hoping that by the latest, by end of July, you will see all these projects being rolled out. There are about 35 of them in all. So that is what I can say for
Thank you. Thank you so much. And colleagues, I think there's something very important in what he has said. The role of the media is to inform, to entertain, to educate. It is right for citizens to say, we saw sword cutting, we haven't seen the building. But we are being educated about what goes on in the first 6 months. I want to implore you to also take opportunity and educate your audiences that apparently something goes on for about 6 months before you start seeing blocks. So that the expectations of the citizen in a democracy, which is met by factors including information, you provide the citizen with that information that, actually, within the first 6 months, there's soil testing, there's design validation, there's all of these things that goes on. You may not necessarily see the building, but it doesn't mean work hasn't gone on. And that is why, assuming they present a report, they'll say ongoing. And then sometimes you find somebody who will go and stand there and say, look at me, I'm standing at the place, look at me, behind me, there's nothing ongoing here. But there's a technical explanation for that. And it is important that we understand and that we can also educate our audiences. Minister, I'll give you the final word on the way forward on the vaccine programs and whether the August vaccine is COVAX or by purchase.
Thank you very much. The status of the 18.5 and the 19. If it was in April or March this year, when we had that massive upsurge, I don't think we'll be asking about the status. People will rather be pushing me to move very hard. But because we've managed ourselves to this extent, and things are a bit slow now, we think that it is gone, so we should be careful. I will link this point to the Johnson & Johnson question. Kwajo. COVAX is giving us, initially they said 20% of the population for free. Then later they said they will increase to 30%. That is not confirmed yet. To vaccinate the rest of the population, government itself should find the vaccines. So far as we are not producing, it means we should procure from somewhere. So Johnson & Johnson, we are buying. We have even made some 15% deposits to get ourselves properly situated on their platform to show commitment that our order is backed with some political will. So we'll begin to receive in August. Now, we are finding challenges with bilateral engagements. I've mentioned Russia, but we needed vaccines. So we have to utilize people who claim they had authority to sell for Russia. And that is what we were doing. The LC that we did, we are still waiting. The schedules that we have in the agreement becomes effective. The agreement becomes effective after ordering and issuing letters of credit. Because they haven't been able to supply us even with the first 300,000, we have to hesitate a little bit to make sure that they are going to perform before we do the next LC. The Russian agreements are about similar. So the second one we even did, we are only hesitating to see if the first one can actually bring before we go ahead to try to do the LC for the second one. Whatever it is, we may have to procure. And so far as we are getting bilateral engagements to do, we wouldn't have options than to continue to engage middlemen to some limited extent. Thank you.
Thank you. Minister, I want to thank you. Member of Parliament for Doma Central, Minister responsible for health, giving us a brief this morning on three major things. One, the COVID response program is on track despite the challenges that come up every now and then. And Minister, while at that, you are talking about even the issues with the COVID vaccines and the fact that you're even using on-site LCs as your instruments of payment. Yes. So it's not like you are giving money to some middleman to go and look for it and bring it. There's somebody who says it's an authorized dealer, it's an authorized agent, and what you've given is a letter of credit, an on-site letter of credit. If you supply, at a time when even COVAX is not delivering their numbers, if you supply, you get some payment. So Minister has explained that one. He's also spoken to the second brief, which is to do with the fact that the other things we were dealing with before COVID came, we are actually making gains or holding our own in those areas. And I think that's very significant. Maternal mortality, malaria, tuberculosis, many of those areas. And colleagues, I really implore you, make some time and take your audiences through, get your analysts to examine this data, and let's have a detailed conversation about whether or not these claims are true and what it means for our healthcare advancement exercise. And then finally, Minister has been speaking about health insurance and the kind of gains that are going on there. What excites me is the active enrollment. That is the percentage of the population that is actually using it. It's gone up from 40% to 52% in the last 4 years. And it's as a result of the various interventions, including renewal, matching with NIA card, etc. And I think that these are important things that you should let the nation be aware of. Colleagues, we want to thank you that you've been with us this morning. Minister and your team, thank you so much. We wish you all the best. We'll see you most likely before the end of the week. Thank you.
Powers and principalities.
There's so much fire inside me.
Tragedy struck when part of the largest hillside at the kosher rubbish dump collapsed.
It's going to be fun to see how he goes about approaching this game.
We table issues relating to the arts and entertainment for a riveting discussion, of course, without fear nor favor.
The question the presenter asked them was a dumb question. You need to speak the fact and move.
Varied views. We agree to disagree.
So I would disagree with everything you said. I think that he's a smart guy. I think what he did.
No, but I also said he's a smart guy.
Yeah.
I guess that I'm waiting for the what next. Yeah,
I don't think that we have to wait for what next.
It sometimes gets confrontational, but that's the beauty of the game.
Today you're denying funny face. It's not my brother. Today you're denying funny face. I don't know him. You don't know funny face. It's not my brother. You don't know funny face.
It's a package. We meet, we sit, we dialogue, we learn, we progress. My name is Benefo Huabin Abrantepa, a proud blogger, and this is my forum.
Having a big dick comes with a whole different skill set necessary to make that big dick work. Because for all women's big talk, most of them can't take, dicks of a certain size. She can't even give you a proper arch. Like, instead of giving you the slide, she's giving you the abdomen bridge. Like, what's that? People think when you have a dick or when you have a vagina, then you automatically know how to have sex. You don't.
It's not by force to make every lady come.
Hey, wait.
It's not by force.
As a guy, when you're getting sexual with a woman, no matter what, you will enjoy. No matter what, your cum is almost always assured.
At times you don't have to take off the panty to eat the pussy. You have to actually use your fingers to slide it,
Slide left, slide right.
Yeah, women are out here thinking because they have a vagina, it's worth something. Look around you. Everyone has one. Yeah. See, some of these girls are out here mastering sex. You'd be with a girl, she's trying to give you head and her teeth are all... Keep your teeth off my dick.
Page number 14. Page 15. Page 16.
Okay, Honorable. Let's go to Mr. Speaker. The Speaker at page 16.
item number 3, the list of those in attendance. We need to do some few tidying up, Mr. Speaker. The item number X, Roman numeral X, Mr. Samuel Enimado, Samuel has not been captured accurately. Number VII, Mr. Tony Orbin of the Ghana Football Association. Orbin is AUBYN without an I, so if that can be cleaned up. And the Speaker, you know that these days in our country, people cherish their titles very much. So item number V, Randy Abe is now a doctor and not Mr. So if these items can be cleaned up, Mr. Speaker, thank you very much.
Okay. Table, please take note. Finally, page number 17. Yes, Majority Chief.
Speaker, I take notice of the fact that my good friend, Jonava Blakwa, has been quite consistent when it comes to correcting votes and proceedings. But I want to bring his mind to the fact that particularly titles, and at the meeting renders vote, if the person in question is or a title, I mean, what becomes of the votes and proceedings? The votes and proceedings must reflect what was captured at the meeting. So we need to find out and confirm if indeed the said correction, particularly with titles, related to titles, if the persons involved indicated that the title should reflect, say, I think it's important we recognize it.
Well, if the person actually indicated that it's Mr., then we should take it like that. But with respect to the spelling of somewhere and those, please table take note of them. Honourable members, the votes and proceedings of the 12th sitting of the second meeting of the first session held yesterday, Tuesday, 15 June 2021, as corrected, are adopted as the true records of proceedings. Honourable members, we move to item number 5, question. We will first invite Honourable Minister for Defence to respond to an urgent question from a member, Honourable Samuel Brakwa. Honourable, you may now ask your question.
Most grateful, Mr. Speaker. Mr. Speaker, please, I rise to ask the Minister responsible for Defence whether the presidential jet, the Dassault Falcon 90 EXE, is in good condition and considered airworthy. Thank you, Mr. Speaker.
Yes, Honourable Minister.
Thank you very much, Mr. Speaker. Mr. Speaker, this question offers the Minister of Defence, particularly the Ghana Air Force, an opportunity to explain matters related to Falcon 900 EXE with registration number 9G-EXE and its airworthiness. First of all, Mr. Speaker, many Ghanaians wrongly believe that the VVIP jet Falcon 900 EXE is the property of the presidency.
Let me explain today, for the benefit of the people of Ghana, that the VVIP jet is the property of Ghana, but held in trust by the Ghana Air Force. And any time the president or any other VVIP intends to use it, the chief of staff at the presidency has to write to the Minister for Defense to seek permission to use it. Mr. Speaker, the Ghana Air Force has for a long time had asked for the re-equipping of the communications squadron to enable them perform their functions effectively. President John Ajekun Kufuor heard this plea and decided to acquire for the Ghana Air Force a Boeing business jet, which is a BBJ, and I will continue to refer to it as, and a Falcon 900 EX EasyJet, though he knew at that time that he would not use them during his time as president. Mr. Speaker, the BBJ could carry over 100 passengers and about 40 passengers on VVIP settings, and it was intended for long-haul journeys and also to act as a spare lift. The Falcon 900 EX EasyJet, which has a maximum of 11 passengers minus the crew, was to serve as a backup to the BBJ and also to serve shorter routes. But for some strange reasons, Mr. Speaker, the BBJ order was cancelled by the new government in 2009. The Falcon 900 EasyJet was the only aircraft that was delivered in 2010. The current Falcon 900, though serviceable, lacks enough range to reach long-haul destinations without refueling stops. The Falcon 900 jet will technically stop at airports where the president does not intend to do a stopover, and this could lead to unnecessary delays and placing a burden on an unintended host to offer diplomatic courtesies that they would not ordinarily be prepared for. Typically, a normal refueling stop takes about 1 hour, but in this stop, refueling may take about 2 hours or more because the passengers have to disembark and or the host country security has to enter the aircraft to inspect. The era of COVID-19 and its associated protocols, including distancing, has further brought to bear the inadequacies of our current aircraft fleet. Mr. Speaker, we must remember that ideally, a president must travel with his office, that is staffers who will be around him in order for the president to be able to do his work efficiently and effectively, even without wars abroad. As it stands, Mr. Speaker, it is important that he travels with his security as well as his presidential press corps when necessary. Currently, when the president uses the Falcon 900 EasyJet, most of these other necessary staffers travel commercial would increase costs as well as suffering attendant delays in transit because of the lack of direct flights to ultimate destinations. Because of the lack of direct flight to the ultimate destinations, Mr. Speaker, where the president has to travel to 2 or 3 destinations on a trip, 2 or 3 separate staff units have to be deployed to each of these countries. With the travels lately, especially within Africa, staffers sometimes do not arrive at the intended destinations in time to make the programs. Ultimately, cost is a huge drawback as well. Mr. Speaker, the communications squadron of the Ghana Air Force is the diplomatic and strategic reach of Ghana. That reach and influence is a national grant that requires air assets that are commensurate to the volume of government business beyond the boundaries of Ghana. Diplomacy is speed and influence as well as investment. The capacity of the current Falcon aircraft is far below that of Fokker 28, which flew VVIPs of more than 25 passengers during the era of Achampong, President Achampong, President Akufo, President Rawlings, and President Kufuor era. Hence, the urgent need for an appropriate aircraft which can better carry a payload of between 70 and 100 people, and to carry their luggage as well without affecting of the aircraft. Mr. Speaker, it is interesting to note that the armed forces of countries such as Mali, Senegal, Burkina Faso, Ivory Coast, Eswatini, Nigeria, Chad, Niger, which is some people call Niger, Uganda, Congo, Kenya, Morocco, Equatorial Guinea, just to mention a few, all have a Boeing or Airbus jet of the capacity I have just mentioned to serve as strategic airlifts. Mr. Speaker, the Ghana Air Force of Ghana is once again requesting for a multifunctional aircraft to add to its inventory as a requisite command and control asset to be able to connect Ghana's national security to diplomacy. The strategic value of this jet is not less a national asset, and indeed, it compares equally to acquiring fighter jets as well as armed helicopters. Our Airbus jet is born out of deep and understanding of the Ghana Air Force capability to link diplomacy, international security with national vital interests. It is more expensive than BBJ or Airbus jet, which can serve as a strategic airlift. For example, Mr. Speaker, Ghana has spent over 50 million United States dollars over the last 10 years since the BBJ was cancelled to ferry soldiers going on peacekeeping alone. If the Air Force had a strategic airlift, this amount of 50 million United States dollars would have been saved to the Treasury. If I were to add, Mr. Speaker, for example, football players, domestic travels, government, parliamentary travels, chiefs, and other opinion leaders that the Air Force is normally tasked to airlift, the figure of 50 million United States dollars would easily double over the last 10 years. Mr. Speaker, permit me to share some few thoughts on the cost of traveling by aircraft that we have on our inventory. Of all the categories, Mr. Speaker, that we have, the Mi-17, which is the helicopter, is the most expensive per working hours and maintenance. 1 hour of a chartered Mi-17 by the UN or World Food Program is 5,000 United States dollars. 1 hour of a CASA is 10,000 United States dollars. And 1 hour of a Falcon 900 is 10 States dollars. These are standard prices for planning. But for a president, Mr. Speaker, who flies every 3 or 6 months in a year, the use of a bigger chartered jet will ultimately become cheaper if the delegation is more than 20 people or 20 passengers. Mr. Speaker, President Nana Addo Dankwa Akufo-Addo is one president who prefers to go by road if the Ministry of Defense considers his schedule. If we consider his schedule within the country and outside the country, this president normally would prefer to travel by road. The choice to travel by road or by sea is a national security imperative. And I have reason to release the aircraft, this particular aircraft, to other VVIPs, including ex-presidents, to carry out national duties. VVIP or presidential travel is not about aircraft type. It is not even about cost, but it's all about safety and safety of the aircraft crew and the passengers. In conclusion, Mr. Speaker, the simple answer I would have given to the question asked by the honorable member would have been a simple yes. The Falcon EX with registration number 9G-EXE is serviceable. But as members will now appreciate from my explanation earlier, the decision to travel particularly to long and multiple destinations, such as the president traveling to France, Belgium, South Africa, and back to Ghana, especially during this COVID, would always require a larger capacity aircraft, such as a BBJ or an aircraft ACJ 319U, even when the Falcon is airworthy. Thank you very much, Mr. Speaker.
Thank you, Honorable Minister. Yes, Honorable Member, any supplementary question?
Yes, sir.
Thank you very much, Mr. Speaker. Mr. Speaker, my first supplementary question is grounded in the Parliamentary Hazard of 19th March 2008, when this presidential jet in issue was laid before, would be able to carry 10 to 15 passengers. 10 to 15 passengers. Not the 11 the defense minister has told us today. 10 to 15 passengers. And cover over 4,000 nautical miles. That is Asia, North America, and Eastern Europe. Asia, North America, and Eastern Europe. The defense minister also informed the committee that the delivery period of the new aircraft will be within the retiring deadline period of the 3 existing aircraft, that is 2010. The technical team from the Ministry of Defense further indicated that the aircraft has a lifespan of at least 20 years, unquote. So, Mr. Speaker, this House approved this presidential jet with the understanding that it can fly 4,000 nautical miles to Asia, North America, and Eastern Europe. Today, the defense minister is telling us that France is so far away and that the Falcon is not the ideal aircraft to use to France. How does the defense minister relation he has provided today with what this House approved on the 19th of March 2008? And he was a member of this House.
Yes, Honorable Minister.
Mr. President, Mr. Speaker, I said, and let me repeat, this aircraft has a payload of 11 minus the crew. In fact, Mr. Speaker, when this aircraft is traveling, in practical experience, since it was acquired and delivered in 2010, whenever the aircraft is traveling to the eastern part of the United States or Asia, the aircraft will not load crew more than 8 plus the luggage. So it depends on where it is going and the payload with it. Secondly, in my answer, I have said that the aircraft has to do refueling stops. When this aircraft is going to the United States, it will do a refueling stop in either Senegal or another island. I've said that before. And I said, in this COVID era, when you are going to travel to multiple destinations, for example, in the president's travel, he went to France, took a train from France to Belgium and back, not with an aircraft. Used cars within his movement, not with an aircraft. And left for South Africa. And I said that if you wanted to travel, for example, from Europe to South Africa, he has to do a technical stop. And it is not desirable. When the president, as I again said, when the president is traveling with more than 20 people for a business trip as this president has done and brought in more than 75 million for this nation, he will need more than just a falcon. Otherwise, the people would have to go a day ahead of the president to prepare themselves. The president, in fact, has to go a day ahead because no president can shower in this aircraft. You cannot freshen up in this aircraft. So you cannot move from this aircraft straight into a meeting. Using a commercial plane, Mr. Speaker, is the same thing. If you are going and you stop by Emirates, the Dubai government will have to give you courtesies. When you are going to the United Kingdom, the United Kingdom government will have to give you courtesies that are not necessary. That is the reason why the Togo government, the Togo president, Mr. Speaker, in the last ECOWAS meeting for 30 minutes, he chartered the same aircraft that our president chartered in France. He chartered the same aircraft. So, thank you, Mr. Speaker.
Yes. Any further supplementary question?
Yes, I have two more supplementary questions. Mr. Speaker, I intend to exhaust all of them. But just to place on record, Mr. Speaker, that if you use Emirates first class, you can shower. KLM, British
Honorable member.
You can shower.
Honorable member.
That information you are providing
Honorable
is
member.
not accurate. But
please go ahead with your questions.
Yeah, Mr. Speaker, I'll move to my second supplementary question. The Honorable Minister is telling this House that because the Falcon, according to him, minus crew, the President has only 11 passenger space, and sometimes 8 if the luggage is huge. So the issue is with more passenger seats. Is the Honorable Minister aware that in the instant case of the President's travel on the 16th of May through to the 25th of May to France, Belgium, and South Africa, the luxurious presidential jet, the charter that he went in, which was about 15,000 pounds an hour, is he aware that the seating capacity is only 17 and that it doesn't address all the concerns you are raising about security, journalists joining the president, all of that? Are you aware that the ACJ 320 Neo that the president chartered is only a 17-seater capacity aircraft? Are you aware?
Yes, Honorable Minister.
Mr. Speaker, a president's crew, ordinary crew just around a president, including every president from President Rawlings to Kufuor to Mahama to all the presidents, a normal crew of a president is more than 10. 17 is adequate to move with the president. 8 is not. Thank you, Mr. Speaker.
Honorable member, your last supplementary question.
Mr. Speaker, reading from the Hansard of 19 March 2008, this House approved over $100 million for these 2 aircraft. He is right that President Mills cancelled one of them, but this cost us about $35 million. That is for the SSB facility. I want the minister to consider the costs of these expensive chartered arrangements. Wouldn't the minister say that it is better for Ghana if the president believes that he wants a bigger aircraft? 2 years ago, when we reviewed the budget of the Office of Ghana Machinery, the president has spent 69 million cedis on presidential travels and all these chartered arrangements. Wouldn't we be saving money? You advise the president to acquire a new aircraft instead of this expensive 15,000 pounds an hour arrangements. Clearly, this cannot be sustainable.
What would be your view on that, Honorable Minister? Mr. Speaker, let me thank the Honorable Member. I think I largely agree with him. That is all the point I have made, that it is better to acquire a better aircraft that can do the work and also to act as a strategic lift. Because what the Air Force has asked for is that give us a bigger aircraft that would also be configured to lift soldiers, to lift parliamentary delegation, to lift footballers, rather than what we are doing. Because this aircraft cannot do the job. But if you have a bigger aircraft, that aircraft can be used to lift all the people you want. For example, that 50 million I just mentioned would have been saved. So they travel whoever they want to travel, and anytime they want to move soldiers, they move the same soldiers. For example, if you go to Ethiopia, when the president of Ethiopia, prime minister of Ethiopia wants to travel, they commandeer one of the Ethiopian airline aircraft, configure into a presidential plane, and travel, and after that they give it back. That's all the aircraft force has asked for. And that was what the BBJ was meant for. The one that was cancelled was meant for. It was meant to be used to configure to travel with the president in long haul, and when it comes back to the country, they will configure to travel, to send soldiers, to send footballers, to send other people. In this COVID era, Mr. Speaker, Ghana Air Force was asked to go to Senegal, Cameroon, Benin, to bring in Ghanaians. But we were using the CASA. That is not the way we should go. So I want to thank him that it's a good idea, and I think I will support that. That's all I've been saying. As for the issue of cost, Mr. Speaker, is relative. For example, when the last government was leaving, they ordered the presidential fleet of cars to the tune of $9 million United States dollars. This government said it was too expensive and cut it off to less than $7 million United States dollars. So cost is relative. I'll give you an example, and you know that that aircraft that was cancelled was not about cost. It was not that Ghana could not afford. It was not about cost, because if it was about cost, we paid judgment debt more than that amount of money that would have bought a new aircraft. At that same time, we paid judgment debt to people, and later we said it was fraudulent. And that judgment that could have given us brand new, and we cancelled it. So it was not about cost that we cancelled the aircraft that the military asked for. But it could be other reasons. And for the government of the day to tell us the reason they cancelled what the military asked for, and could pay judgment debt. So I agree with you, we need a new aircraft. Thank you, Mr. Speaker.
Mr. Speaker, I haven't said we need a new aircraft. I'm talking about the cost benefit analysis.
Honorable member, you've exhausted your...
Yes, but you should not misquote me, Mr. Speaker.
Honorable members, please, when you look at the items on today's order paper, please. What I'm saying is that when you look at today's order paper, the items are many, and we need to go through all of them. I will therefore invite only 2 supplementary questions. This is my position. Honorable Anodombre, you may have 1 supplementary question from this side, 1 supplementary question from me. Honorable Anodombre.
Speaker, I thank you for the opportunity. Speaker, as I want them to
Honorable members, order, please.
Speaker, thank you for your kindness. I'm particularly excited. The minister has put matters to rest. As part of the minister's answers, and Speaker, if you permit me, let me just quote parts of it. The Falcon 900X EasyJet, which has a maximum of 11 passengers minus a crew, was to serve as a backup to the BBJ and also to serve shorter routes, but for some reason The BBJ order was cancelled by the new government in 2009. We all know then government was the NDC government. Is the minister kind enough to tell this August House and to tell the people of this country what was the motivation behind the cancellation of the BBJ contract?
Honorable Minister, if you are minded to answer the question. Please, order, please.
Mr. Speaker, the records at the Ministry of Defense do not point to any specific reason. I have not cited any reason from the Ministry of Defense. But what I know is that it couldn't have been the issue of resources. It couldn't have been the issue of money. Because around the same time, June, July, when the decision was taken to cancel the request of the Air Force, Ghana found money to pay in excess of double of that amount of money as judgment debt. So it could not have been the issue of resources. It is possible.
Honorable Minister, hold on. Yes, honorable available.
So I want to just conclude by saying that
honorable
I
Minister,
don't know the answer.
Honorable Minister, hold on, please. Hold on, please. Yes, honorable available leader, what's your issue?
The defense minister said he has no record as to what, because the question was hypothetical. He said the motive. In other words, the minister was being invited to think into the head of somebody in the past. And he answered by saying that there's no record. Yet he's venturing into providing answers which doesn't exist. Is that what you're supposed to do as a minister? The answers don't exist. Why don't you say, I don't have an answer?
Honorable Member, please allow the minister. Probably he has certain information for us. Please. Yes, Honorable Minister, please go ahead.
Mr. Speaker, if you're in a boxing match with somebody and your opponent says, I want you to throw the blow this way, I don't know how that one works. You have asked he has asked a question. I am answering to the best of my knowledge. All I have said is that I don't have an official answer in my ministry why they cancelled. But it is not about the issue of money. Because Ghana at that time found money to pay judgment debts more than double the cost of that aircraft. So it is not about money. That's all I said. Thank you, Mr. Speaker.
Yes, honorable member for Yuabuso.
I'm most grateful, Mr. Speaker. Mr. Speaker, is the minister telling this House that we couldn't have gotten an aircraft, any aircraft, especially from the same company, with more than the 10-seater capacity that could cost us less than the £15,000 per hour?
Per hour, yes.
Yes, honorable minister.
Mr. Speaker, as I said, the choice of an aircraft is not the issue of resources. The choice of an aircraft, as for a country, is about the safety of the crew and the VIPs who are traveling. If Parliament writes to the Minister for Defense for an appropriate aircraft to travel with members, as you have been doing, why I'm looking for an aircraft for you, the first thing I consider is your safety. Because a CASA aircraft is 10,000 United States. So from here to Tamale, it will cost the country 10,000 United States dollars. But if I were traveling, if I were to give you a helicopter, it will cost you 5,000 United States dollars. But I always give you the CASA because of your own safety. So the first priority is safety first. And I've said that many countries, including Senegal, that has 2 of the type of aircraft our president has used. Ivory Coast, that has 1 and another one to be delivered this year. Niger, Mali, they choose these aircraft not because they believe that Ghana afford it or they can afford better than Ghana. but the safety of the people they are lifting and the strategic lift nature of such aircraft. That's what they accuse it for. So yes, the ACJ 319 Neo that the president used is an aircraft that delivers on safety, and we are happy that the president was back safely. Thank you, Mr. Speaker.
Honorable members, honorable members, honorable members. My ruling was that I was giving each side one opportunity to ask a political question. Available leader.
Mr. Speaker, to be fair to you, what I heard from the front of the minority is that you give 2 each. So I was surprised when Honorable Adonfre was the first to take the opportunity. In fact, Mr. Speaker, that is why I didn't even get up. Because I thought if we were going to give 2 positions each. Mr. Speaker, that is why
Honorable members, I am very particular about whatever I said. I said I'm giving 2 opportunities, one to this side, one to this side. This is what I said, and I stand by that. Honorable Minister, we thank you for attending to an urgent question. You are hereby discharged. Honorable members, let me invite Minister for Energy to also come and answer questions from members. The first question for the Minister of Energy stands of a member from Sisala West, Honorable Adam Mohammed Sapalu. Honorable member, if you are around, please take the floor and ask your question.
Thank you, Right Honorable Speaker. Right Honorable Speaker, I rise to ask the Minister for Energy when the following communities in the Sisala West constituency will be connected to the national grid: Pana, Sangbaka, Kudni, and Bele. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Speaker. The communities named Pana, Sambaka, Kudi, and Bele form part of the Ministry of Energy's On-5 rural electrification project in the Sisala West district of the Upper West region. All the high voltage poles required for the project have been supplied and planted at the site. Pole top materials have been supplied, and the HV high voltage network completely strung at Bele community. Transformer for the Bele community has been installed, but not yet energized. Some HV pole materials have been supplied to the remaining communities, but stringing of the networks is yet to commence. Most of the low voltage poles required have been supplied and planted in all the communities. The ministry is, however, yet to supply the low voltage pole top accessories to allow for stringing to commence. The delays in the execution of the electrification project in the above communities are as a result of shortage of some key materials and equipment, including copper wires, LV poles, etc. The ministry is taking some deliveries of these materials and equipment, and will arrange for the release of some of these installation works to resume at the sites. The Ministry of Energy expects to complete the installation works in the above-mentioned communities by the end of 2021.
Yes, honorable member, is there any supplementary question?
Thank you, Right Honorable Speaker. Right Honorable Speaker, may I ask the Honorable Minister to know what actually caused the delay of the delivery of the equipment?
Yes, Honorable Minister. Mr. Speaker, if I get my colleague right, by the non-delivery of some of the items from our importing companies, and that's the promise I'm giving, that we hope to complete the works by the end of the year.
Honorable Member, any further?
Thank you, Right Honorable Speaker. May I give Honorable Minister to know the timelines for the delivery of the equipment, since it did indicate that those communities will be connected by the end of 2021.
Yes, Honorable Minister. Mr. Speaker, end of 2021 is the timeline. Yes. Yes, Honorable Member for Bongo.
Thank you very much, Mr. Speaker. Mr. Speaker, I would want to ask the Minister, based on the fact that he indicated that most of the accessories for the low voltage poles have not been there. It has been across all the time we ask questions here. It's about the fact that there's a shortage of materials. Can the Minister indicate to us when these materials will be available for all the ongoing projects within the country in terms of the rural electrification projects?
Yes, Minister. Thank you, Right Honorable Speaker. Mr. Speaker, this contract was signed way back in 2016. Mr. Speaker, that Ministry of Energy, with my colleague, was a very instrumental gentleman in the ministry, did place orders for these materials. As soon as your deliveries, the orders placed arrived, because COVID also intervened and affected the whole global transport systems, logistics systems. So most of the companies had written that they couldn't deliver in those times, and they are willing to now deliver. As soon as they do, which is the escalations, because the cost of shipping a container from China to Ghana, which was about $1,500, is now over $9,500. But the companies do assure us that they will bring in the equipment as soon. And if they do, as they promised, then I can stand by my timeline that I've given my honorable gentleman. Thank you.